HEA 112 notes. There are two types of emergencies. The first one we're going to talk about is a life-threatening emergency. And this is basically an example would be a heart attack, a stroke, someone going unconscious, so with the ability to circulate oxygen to all of its body parts. A non-life-threatening emergency is going to be an example such as a cut, a broken bone, a sprain, a situation that does not have immediate impact on a person's ability to circulate blood, but still might require some medical attention, just not immediately. So you are the first link in the chain of the EMS links. So remember yourself as a lay responder. And so a lay responder means that you're going to recognize that an emergency exists. You're going to decide to act. You activate EMS by calling 911, and you give care until medical help arrives and takes over. So again, from this course on, you're going to be referred to as a lay responder. So the next step is recognizing that an emergency exists. So some things that might come into recognizing that an emergency exists is unusual noises, such as someone screaming or screeching tires. Sights might be a lot of blood, or you might see a car crash happen. Odors, are you smelling gas? Or does someone just kind of look like they're not okay? Like they might have this panic-stricken look, or they might have like a bluish ashen color skin, or they're sweating profusely. Some barriers as to why we might not react. One of the first ones is a panic or fear of doing something wrong, being unsure of the person's condition and what to do, assuming that someone else will take action, what type of injury or illness, fear of catching a disease, fear of being sued, being unsure of when to call 911. So I want you to think to yourself, do you have any of these barriers that might prevent you from reacting immediately? And it's okay if you do. Our goal by the end of the summer is to figure out which barrier do you have and how do we overcome it. So if you don't remember anything in HEA 112, I want you to remember that calling 911 is the most important step. And once we recognize that an emergency exists, we're going to continue to give care until one of the following reasons occurs. So you're giving CPR in an obvious sign of life, such as someone is conscious or breathing. Another responder or EMS takes over, too exhausted to continue, the scene becomes unsafe, or an AED arrives. So those are the 5 reasons as to why you would stop giving care. So I want you to familiarize yourself with those steps. We will use them every day in class. Sometimes when we're dealing with an incident, whether it goes in the person's favor or if the person doesn't make it, you might have to deal with incident stress, and that might require professional help for any post-traumatic stress from developing. When preparing for an emergency, some general good things to kind of have is a list of numbers on the refrigerator, a first aid kit. Your medical insurance is up to date. You want to really teach children how to call 911 and when to call 911, and not just to call 911 and hang up, and how important it is when you're activating EMS. So our 3 emergency action steps are check, call, care. So you're checking the scene, call 911, and you give care until medical professionals get there. And when you're there, if you saw what happened, you'll be able to give as much detail. You're looking around for bystanders, ask the person for symptoms that they're having, and try to figure out maybe what happened, what is happening, as much information as you can, so that when you're making the call to 911, you're able to provide the exact address, who you are and your number, just in case you get disconnected, condition of the person or people, what happened, how many people are involved, what kind of care is being given. But the most important thing is, do not hang up until the dispatcher tells you to. If you're alone, you want to call 911 first. So an unconscious adult or adolescent age 12 or older, a witnessed sudden collapse of a child 1 to 12 years of age, or an infant less than a year of age. An unconscious child or infant known to have cardiac problems are more likely to be cardiac emergencies. You want to give care first when an unconscious person younger than 12 years of age who you did not see collapse, any person who had a drowning incident. This is because they are more than likely related to a breathing emergency. And when you're giving care, we want to make sure that you never transport the person. When a trip may aggravate the injury, when the person may develop a life-threatening condition, or if you're unsure of the nature of the injury. So we always like to travel in packs of 3. You have the driver driving the car, you have the injured person in the back seat, and someone giving care or helping them in the back seat. American Red Cross considers an adult 12 years or older. A child is considered 1 to 12, and an infant is less than a year. And that's going to be important as we discuss this class throughout the summer. Before giving care, you want to make sure that you have your PPE, that's your personal protective equipment, that will be given to you on the first day of class. That is a pair of gloves and a breathing barrier. When dealing with someone, you want to follow your legal considerations. So there's 2 types of consent. Expressed, meaning that the person or someone that knows the person is giving you verbal consent. Implied consent means that if the person was conscious, they would want us to help them. You always, when you check the scene, you want to identify yourself. My name is Alicia. I am first aid, CPR, AED certified. Can I help? That's given their level of experience, what you're trained to do. Ask if you can serve, and explain what you plan to do. The Good Samaritan laws protects you if you are to give voluntarily care, asking nothing in return, as long as your certification is up to date and you are doing everything within your scope of practice. We're going to go over how to properly remove your gloves, and that will be your first checkoff. When checking for life-threatening conditions, remember we talked about a life-threatening emergency at the beginning of this. So someone that's unconscious, trouble breathing, absence of breathing, severe bleeding. We're going to go into more details in just a second.